Hello and welcome back to A Functional Approach. I'm Dr. Jim Chialtas, and today I wanted to talk about anemia. It's something that I see all the time in my clinic. What different types of anemia do we have? There's 3 that I want to get into today, although there's probably about a dozen or more different types of anemias, to be honest. What does it feel like anyways? If you haven't been diagnosed with anemia and you think you might have it, do you qualify for some of the symptoms associated with it? And then, in the end, we'll be talking a little bit about what do you do to kind of get over this condition. It's usually pretty straightforward as long as you know what you're working with. What does it feel like to have anemia, right? The most common concept is probably going to present as fatigue. And I'll explain why in a moment, but fatigue is probably the thing that's going to hit you the most. You just don't have that get up and go, that energy, that vitality that maybe you once had, and something's just not right. Okay, but you could have symptoms of brain fog, right? A lot of times brain fog, that difficult concept of getting things through, you know the right answer, but it's just right beyond your reach, and then it kind of finally comes. That's a very common thing for people to report is brain fog. It comes hand in hand with fatigue all the time. If your brain is not getting what it needs, then we get this kind of cloudy thinking. We get fatigue. Another very common symptom would be hair loss. That's usually a bit more advanced if the anemia has kind of progressed, but you will tend to get a lot of diffuse hair loss all over the head, which can be quite alarming. And that oftentimes is the reason somebody comes in to see me is for hair loss. We dig in and we look and we find, wow, there's this pretty aggressive anemia condition going on. And that's a really important step to fixing the hair loss, right? You might also notice things like pale skin, just that kind of that drawn look where it's just like, what happened to my color? What happened to my vitality? If you look in your eyelids under here, you might notice that instead of a nice pink, it will be kind of pale looking. So, there's not good blood. Think of it that way, right, in the system. And along with like the hair loss and the maybe even just the weak and brittle hair itself, you might get weak and brittle nails. So if you look at all those together, you might consider anemia. One final thing, at least for 50% of the population, it could present simply as an irregularity in the menstrual cycle. Right? Again, that's something that somebody comes to a doctor to address. And my cycle's not right. And the typical treatment might be hormone therapy of some kind or birth control pills, which can be very helpful. But the root cause could be this anemia. Right? So that's functional blood chemistry. That's functional medicine. Right? We look for all those things that might be leading to hair loss and fatigue and menstrual irregularities and so on and so forth. And we get to the bottom of it. I just want to give you a basic understanding of what anemia is. Okay, so we have red blood cells and we breathe oxygen, and oxygen is bound into the red blood cells in a little molecule called hemoglobin. It is an iron-based molecule. So if that's not happening in a healthy way, then we're delivering less oxygen to our tissues. That could be any tissue. Every single cell requires oxygen. So I mentioned a minute ago that I'll explain why fatigue and why some of these things. Well, if you're just not getting the oxygen delivered to your brain and to your other organs and tissues, then those tissues start to kind of falter a little bit. They don't have the gas to go. So anemia, simply put, is any type of condition in the red blood cell where that red blood cell cannot deliver adequate oxygen to your tissues. What are the 3 main reasons for that? Number 1, and probably the most common one that people think about at least, is an iron-based anemia. And in this case, the red blood cells kind of shrink a little bit. So there's ways of looking at a blood cell on a blood test that will demonstrate kind of a smaller red blood cell, and that would be very suggestive of iron need. And of course, we can look into actual iron levels, and there's lots of ways to kind of assess iron in the system. So if we're seeing all those together, then we can say, yeah, this looks like what we might call a microcytic small red blood cell anemia, iron-based anemia. Probably one I see more, honestly, is a B12 or folate need anemia. So, another nutrient. These are vitamins, not minerals like iron, but people can become deficient in these things. They're hard to absorb a lot of times, and people aren't always supplementing. And perhaps you're having you eat a diet that's just not rich in those vitamins, whether it's because of lots of processed foods or even vegetarian and vegan diets, which are of course void of red meat, are lacking that basic food-based nutrient. So it's quite easy to become deficient in B vitamins, folate. When that happens, the red blood cells kind of swell. They do the opposite. So a simple blood test, we can determine, are they small and probably iron-based, or are they big and probably B12 and or folate need anemias? We'd call that macrocytic, right? Big. The third, and not one that I see too often in the functional medical model, but it does come up from time to time, is a type of anemia where the red blood cells are neither large or small, called normocytic, normal. And this is usually actually a side effect of chronic disease or chronic inflammation. So you will see all the anemia markers where the red blood cells are low and the hemoglobin is low and all that. It's all there. But then when it comes to size, they're just normal. That's when we want to look to other things. And, that could be liver disease or kidney disease or really bad autoimmune disease, which is very inflammatory driven. Cancers can do it. So if we see something like that, that's usually a referral to a mainstream doctor to really get a much more thorough evaluation and intervention if necessary. I would call that category of anemia a bit more of a red flag that does require a team. Right? Iron and B12, quite easy to manage, right? Of course. So if you're concerned about any of these issues and you want to have a deeper look, reach out. This is a very simple blood test that we can order for you. I can do this remotely, or if you live in the San Diego area, by all means, come see me in person. We can order this blood test and within a day know exactly how to get you the care that you need, whether that's iron support or B12 or folate, what have you. Or if I can look at this and get you to a doctor to get that deeper level of care, I'm happy to be that resource for you. So I do hope this was helpful for you, and I look forward to continuing conversation with a lot of different medical concepts. Thanks so much for your time and attention. My name is Dr. Jim Chialtas, and this is A Functional Approach.